Hello everyone, my name is Mara Yahner. I'm a student in the PA program at Seton Hill University, and I did my research on how the physician assistant profession has grown and will continue to develop in the future. In this presentation, I will give a little bit of background information about the PA profession, and then I'll go into how the future will look for PAs. So first of all, I'd like to start off by giving a brief developmental history of the PA profession, just to show the profession's early beginnings and to emphasize how quickly it has grown in just about the 50 years that it has existed. As you can see on the timeline, in 1959, the U.S. Surgeon General declared a national shortage of medical personnel. This drew attention to the need for more healthcare providers to serve the increasing needs of the people. So to answer this national shortage, in the mid-1960s, Dr. Eugene A. Stead, Jr. of Duke University came up with the first physician assistant program. He recruited 4 Navy corpsmen and based the curriculum on the fast-track training style of military medics in World War II. In 1967, this first class of PAs graduated from Duke University, which you can see in the picture on the bottom left of the screen. In 1980, you can see, from small beginnings, the profession grew very quickly. By the end of the 1970s, there were 42 accredited PA programs. Today in 2020, there are 260 accredited PA programs. So by this timeline, you can just see how in a short period of time, this profession has grown immensely. Next, I'd like to talk about how the PA profession looks today, very briefly. As I said, there are 260 accredited PA programs. And again, this goes to show how much the profession has grown. PAs today work alongside physicians and other medical professionals in all specialties. For many people, PAs are their primary care provider, or PCP. PAs share many of the same roles as physicians, including performing physical examinations, like you see in the doctor's office, diagnosing and treating patients, ordering and interpreting tests, such as x-rays, prescribing medication, and assisting in surgery. Many patients often see a PA when they go to the doctor's office, and most patients have a highly positive experience with the PAs that they see. So next, I'm going to talk about the future for PAs. Basically, the future is really bright for the PA profession, because they're going to see an increased employment rate, increased wages, and increased autonomy. I will go through each of these points in the next few slides, and I'll address why PAs can expect such a bright future in each of these categories. So the projected job outlook for PAs is a 31% growth rate, which is much higher than other healthcare professionals and all other occupations in general. This is due to the need for more PCPs to aid on the increasing size of the aging and sick population. Baby boomers, in particular, are a very large generation, so as they grow older and get more sick, they're going to need a lot more people to help out in the medical field to assist them. As you can see in the chart on the right, this is from the U.S. Bureau of Labor Statistics. PA's projected job outlook is much higher than the healthcare diagnosing or treating practitioners and all occupations in general. So compared to any other job, people going for PA they're going to have great job security and have lots of choices. So along with job security, PAs can expect a wage increase over the years that not only increases naturally with inflation, but it will continuously exceed inflation. Again, this is due to the high demand of PAs in the medical field. In the chart on your right, taken from a study that was used in this research, the study projected the increase in wages for PAs in blue compared to the natural rate of inflation in red. As you can see, the blue line stays above the red line, which shows that PAs will continuously be making more than the inflation is going to cut down. And you can see the lines even gaps as it goes on, so there's more of a difference between the wage increase and the inflation increase. In the workforce, PAs should also expect increased autonomy. So right now, PAs must legally work under the supervision of a practicing physician. However, PAs have become more and more self-sufficient over the years, which points to the likeliness of total autonomy in the future. Nurse practitioners have already gained complete autonomy in some places, and being at about the same level of skill and education as PAs, they're paving the way for PAs to gain the same autonomy that NPs have in the near future. Today, PAs are already trusted by both physicians and patients to efficiently and effectively provide care to those who need them. So to sum up this research, the PA profession has grown exponentially and will continue to do so as the demand for more primary care providers increases. PAs are becoming more important and more self-sufficient, and therefore they should expect to have increased employment options, wages, and autonomy in the future. For more information on the PA's profession and its history, current events, and research, you can visit the American Academy of Physician Assistants at www.aapa.org. This source proved to be very helpful in researching my topic. I highly encourage anyone who's interested in the PA profession to use this website to their advantage. Thank you for your time.